Have you ever felt that sharp, sudden twinge in your lower back that just stops you dead in your tracks? Yeah, if you have, you are definitely not alone. Today we're going on a little journey, deep inside one of the most hardworking and honestly, one of the most misunderstood parts of your entire body. We're going to really get to know this unsung hero piece by piece. Back pain is one of the great human afflictions. And, that's not just some catchy phrase. It's a deep, deep truth. It's like this universal language of discomfort that connects pretty much all of us at some point in our lives. But what is it about this specific area that makes it so prone to problems? Well, the secret to your lower back's troubles is also the secret to its incredible strength. See, this is your lumbar spine, the five super powerful vertebrae that have the massive job of supporting your entire upper body. It's the critical link in the chain, right? It's transferring every single ounce of weight from your torso down to your pelvis and then to your legs. It's a brilliant piece of engineering, but being right in the middle of all that action, well, that's what makes it so uniquely vulnerable. So how is this incredible structure actually put together? Let's take a closer look and break it down piece by piece. I want you to think of it like we're building a high-tech, flexible skyscraper. It needs a super strong frame, right? It needs specialized joints to allow for all the movement, and maybe most importantly, it needs some serious shock absorbers. So here they are, the steel girders of our skyscraper, the five lumbar vertebrae. These are the big, bony building blocks that form the main column of support. And you'll notice they are way larger and thicker than any other vertebrae in your spine. And they're designed for one thing above all else, pure strength. Okay, so how do these massive building blocks connect and move without just grinding against each other? Well, that's the elegant job of the facet joints. You've got 10 of them back there, 5 pairs, and they basically work like railroad tracks, guiding and controlling how the vertebrae glide past one another. In a healthy spine, they're carrying about 20 to 25% of the vertical load. They might be small, but they are absolutely essential. All right, so we have our building blocks and we have our guide rails. Now let's get to the most critical component and, the part that's often the source of the most trouble, the intervertebral discs. These are the spine's hydraulic shock absorbers, sandwiched right between each of our vertebrae, protecting them from the daily grind. Honestly, the best way to picture a disc is to think of a jelly donut. The tough, chewy outside part, that's called the annulus fibrosus. And it's not just one layer. It's made of about 20 crisscrossing layers of super strong collagen. Then on the inside, you've got the nucleus pulposus. That's the jelly. It's a gel-like center that's mostly water. And this is what gives the disc its incredible, almost magical shock-absorbing power. And this number right here, wow, this really shows you just how important that jelly is. In a young, healthy disc, the nucleus is 85 to 90% water. The super high water content is what makes it so incredibly plump and resilient, just perfect for absorbing the impacts of walking, running, jumping, you name it. It's literally what gives you that spring in your step when you're young. But, and there's always a but, right? Here's the catch. As we get older, that water content naturally starts to decrease, sometimes dropping all the way down to 65%. The disc literally dehydrates. It flattens out, becomes way less springy, and what that means is it loses its shock-absorbing ability, so more stress gets transferred directly to the bones, which leads to a much higher risk of injury. So, what happens when that jelly donut structure finally fails, maybe under years of pressure or from one sudden trauma? Well, this leads to what most people call a slipped disc. Of course, the disc doesn't actually slip anywhere. It's a bit of a misnomer. Instead, it's a physical failure of that tough outer wall. A herniation usually happens in stages. It might start as a simple protrusion, just a little bulge. Then it can become a prolapse, where that jelly pushes out even further, really straining those last few fibers of the wall. If that wall finally tears, that's called an extrusion. The jelly is actively leaking out. And in the most severe stage, sequestration, a piece of that jelly actually breaks off and is just floating in the spinal canal, where it can cause some major irritation to the nerves around it. Okay. We've seen the intricate anatomy of the lower back, and we know exactly how it can fail. But what are the real-world forces that cause this failure? The answer isn't just in, big accidents or injuries. It's actually hidden in our everyday movements. This is the daily pressure test your back is constantly under. So I want you to just think for a second, right now. Whether you're standing up, sitting down, maybe even lying down watching this, how much pressure do you think is on your lower back at this very moment? The answer? Well, it might genuinely surprise you. So let's do this. Let's set standing perfectly straight as our baseline. We'll call that 100% pressure. Lying on your back, look at that.
it reduces the force to just 25%. That's a huge relief. But check this out. Simply bending forward at the waist, boom, can increase the pressure to 150%. And lifting just 20 kilograms, that's about 44 pounds, the wrong way, with a bent back, skyrockets the pressure to nearly 170% of your standing baseline. It's incredible.
And right here, this is the single most staggering fact from all the research. The actual force your disc experiences can be about 10 times the weight you're lifting. So that 44-pound box, you're not asking your back to lift 44 pounds. You're asking your L3 disc to handle nearly 440 pounds of pressure. Just imagine that force day after day. That's when all those tiny tears in that donut wall can start to add up and lead to some really serious problems down the road. Okay, I know that was a lot of information, but it all comes down to one really powerful idea. Knowledge is power. Seriously. Understanding the mechanics of your own lower back, understanding the forces at play, allows you to finally start listening to its signals and making smarter choices every single day.
So let's just recap the crucial takeaways here. First, your lower back is a brilliant, complex system of bones and cushions. Those cushions, the discs, are amazing shock absorbers that, unfortunately, dehydrate and weaken as we age. A slipped disc isn't some vague thing. It's a real, physical injury that progresses in stages. And maybe most importantly, simple, conscious changes in how you stand, sit, and lift can dramatically reduce the pressure on those discs. And knowing this, well, that's your first and most powerful step towards a healthier back. So I'll just leave you with this one final thought. Now that you have this kind of map of what's happening inside your own lower back, what signals is it sending you throughout your day? When you sit, when you bend over, when you lift something, what are your daily movements really telling you? Start paying attention to those signals. Your back will definitely thank you for it. Thanks for tuning in.